start. So is everyone?
I think we're ready. We have lots of attendees right now here, and we're ready to go.
Excellent. Perfect. Okay, so it's a real pleasure to be with you tonight. Actually, I'm in Kuwait, and it is 11 p.m. So it is tonight at my time zone. In Canada, it's 3 p.m. I know. So I hope you are going to be enjoying this coming hour and a half about the state-of-art rejuvenation with Fotona 4D concept. And here, I'm stressing on the fact that we are talking about a concept. There is no magical sticks. We need to understand the problems we are dealing with so that we are able to come up with the right tools and the right treatment strategies in order to resolve the issues and the problems we are dealing with. So if you have any questions during the presentation, please feel free to post them. You can post them on the chat or on the question and answers, and I'll be very happy to answer the questions at the end of my talk. So today we are talking about rejuvenation. And when we talk about rejuvenation, before going ahead, it is really very important to agree among the practitioners and people who are working in that field, what is the meaning of rejuvenation? So when someone is being injected with fillers or Botox or doing chemical peel or thread liftings or whatever procedure, it is really very important to ask ourselves, are we doing rejuvenation or are we doing a temporary fix? So the answer of that question is really very important because we have to differentiate between doing a procedure to improve how the skin is looking rather than doing a procedure to improve the structure and the function of the skin, hence the appearance. And this is the meaning of rejuvenation. So rejuvenation means the restoration of the structure and the function of the skin. And when we restore the structure and the function, we improve the appearance. So if we have a patient like this patient came the first time to me asking for injecting fillers. And I could have injected her with the fillers, and I'm quite sure that many of the colleagues would have done that, and the patient would have been very satisfied with the outcome if we inject her with fillers. However, is this the ideal scenario? Is this the procedure which is really going to restore the structure and the function of the skin? When the filler is gone, is her skin going to be looking better than before, or is it going to be worse than before? This is a question which we need to think a little bit about it and answer, and hence we are going to take the right decision according to our knowledge, our expertise, and what we would like to achieve with this particular patient, temporary fix or rejuvenation. So it is really very important to remember the characteristics of healthy skin, because at the end, either we have a patient who is having healthy skin, which we would like to maintain, or the patient started to lose the appearance and the characters of the healthy skin, and this is something we want to restore. So it is very important to remember the basics, remember where we are standing and what we would like to achieve in order to plan our strategies correctly. So the healthy skin is smooth, and smoothness of the skin is coming from the normal keratinization. When we start to have photo damage, it is associated with hyperkeratosis, and with hyperkeratosis, we start to lose the smoothness of the skin. Our skin becomes rough. The healthy skin is firm, and the firmness of the skin is coming from abundant, normal functioning collagen and elastin. So this means that it is enough in quantity and enough in quality. So when we have enough collagen and elastin of good quality, our skin is going to be firm. What about when we lose the collagen and elastin? then we start to lose the firmness of the skin, and we start to have wrinkles, large pores, and the skin is not going to be stretched enough, and we are going to have older looking skin. At what age do we start to lose the collagen? From the age of 20. From the age of 20, every one of us will start to lose 1 to 2% of our body collagen, and the areas which are exposed to the light, the loss of collagen is doubled. And because of that, the quality of the skin in the exposed areas is a little bit less than the quality of the skin in the areas which are hidden from the light. The healthy skin is evenly colored, which requires properly functioning melanocytes. If we start to have hyperactive melanocytes, then we have hyperpigmentation. If we start to have lazy melanocytes, then we are going to have hypopigmentation. And this is what we call dyschromia, and it happens with the photo damage. So this is something which gives the skin a less youthful appearance. The healthy skin is properly hydrated, which requires intact barrier function. And intact barrier function is very much linked to the normal keratinization. Those are very much interlinked characters. The proper hydration and the smoothness, because both of them are coming from the normal keratinization and the intact barrier function. So those are very much interlinked together. The healthy skin is free of medical diseases. So if we have acne or eczema or psoriasis or vitiligo, this is a medical condition which needs to be treated. Otherwise, the skin does not look healthy. And finally, the healthy skin is free of environmentally induced deterioration, an insult which occurs every day. And this is the answer for those who are asking you, you are going to do rejuvenation for me, laser or whatever else, for how long it's going to stay? It's going to stay for a few months, maybe a few years. But as long as our skin is exposed to the environmentally induced deterioration on daily basis, as long as we are aging on daily basis, as long as aging is the dynamic process, rejuvenation should be also dynamic, and we are supposed to be doing number of sessions, and then after that we need maintenance. So this is a strategy. This is a way of thinking. Now, the most common problem or mistake I have seen in our field is that most of us sometimes are having a telescopic vision. A patient coming to complain of melasma. Where is the problem in all those elements? The problem is in the functioning, the properly functioning melanocytes. We have uneven skin color, and we need to focus on that. So most of the practitioners are going to focus on the bleaching agents, how to control the melanocyte activity, how to decrease the melanin production, and that's it. And then the patient is never satisfied. The patient is going to leave one clinic to go to another clinic because those patients are not finding what they are looking for. As a matter of fact, although they are coming to complain of hyperpigmentation, this is not the only problem they have. They might have a problem with the keratinization of the skin. They have a problem with the collagen and the elastin content of their skin. They have a problem with the coloration of the skin, but also they have a problem with the barrier function of the skin. They have dysfunction in the barrier function of the skin, and they might have a medical disease in this case, which is the melasma, and their skin is exposed to environmentally induced deterioration. So if we focus our efforts and our treatment to improve the melanin of the skin, this is enough. Number one, the melasma is a chronic disease. It is going to come back, so the patient is not going to be satisfied. Number two, whatever we do, we are not going to get rid of the melasma 100%. So this is not going to be satisfactory for the patient. What is going to be satisfactory for the patient is to target the melasma, to target the pigmentation among a whole treatment plan in order to improve the keratinization of the skin, in order to stimulate the collagen, in order to control the melanocyte activity, in order to improve the hydration of the skin, and in order to treat any other condition in the skin. So this is how we should approach that, because in this case, when the patient is looking at the mirror after a few weeks of treatment, then this patient is going to find that the skin is becoming much more healthy, much more younger, smoother, firm, and it is, if there is any laxity, it has improved. The light reflection is going to be much better, in addition to whatever we are going to do for the melasma. So it's a strategy. The same applies if the patient is coming to complain of skin laxity or acne scars or large pores or wrinkles or whatever. We have to work on the skin, improve its characteristics in order to restore the structure and the function of the skin. This is the most important message of today, that regardless what is the problem the patient presented with, it is really very important to restore the structure and the function of the skin. And in this case, the patient is going to be satisfied even if we were able to achieve just partial improvement of the problem the patient presented with. When we talk about aging of the skin, it is very important to understand how we age and how our skin is aging and why it is aging and what are the changes happening while we age. So biologically, when we age, there are two major problems or changes happen in our skin while we age. Number one, reduction in the basic substance of the connective tissue. And because of that, we become shorter when we get older, because bone is a connective tissue, and with aging, we get bone resorption because of the reduction in the basic substance of the connective tissue. The second change is the diminished rate of cell proliferation. The proliferation of cells is becoming much slower. And because of that, we get very slow wound healing in old age. While we are children, wounds heal very quickly, but in old age, it becomes much slower. So those are two major changes happening in our bodies when we age, and this is called the biological aging. What about our skin? Our skin is a body organ which is subjected to this biological aging as with any other body organ. However, the skin is different than any other body organ by the fact that it is the interface with the environment. It is the first barrier to protect our internal body organs from the environment. And because of that, our skin is having two types of aging. We have the chrono-aging, which is the biological aging, and that's why we call it intrinsic aging, because it's due to factors coming from within the body. But also there is another type of aging our skin is subjected to, which is called the photoaging or extrinsic aging. So those are two different types of aging our skin is subjected to: chronoaging or intrinsic aging, and photoaging or extrinsic aging. And we have to differentiate between those two types of aging because the pathogenesis is different and our treatment approach should also be very different. Let us understand and see what happens to the epidermis and the dermis while we get chronoaging and while we get photoaging. As we mentioned before, chronoaging is a reflection of the biological aging. So we get reduction in the basic substance of the connective tissue. We have connective tissue in our dermis, which is the collagen and elastin, and that's why we are going to see collagen synthesis reduction and loss of elastic fibers. When there is diminished rate of cell proliferation, the dermis is becoming thinner, and also the epidermis is going to have fewer cells, and this will end up with thinner skin. So in this case, our skin is atrophic, thin, delicate, and if we would like to correct this chronoaging, our main objective should be directed towards stimulation of the collagen. So in chronoaging, the main insult is collagen loss, and we need to do something in order to rebuild the collagen in our dermis. On the other hand, the photoaging is a protective mechanism where we are having an insult coming from outside. The skin is feeling that there is injury and there is harm, so it tries to protect itself by becoming thicker. So we are going to have hyperkeratosis at the level of the epidermis, and regarding the dermis, we are going to have thicker dermis, stretched blood vessels in order to bring more nutrition, and inflammatory infiltrate. The cells of war are going to be migrating into the skin in order to protect the invasion from outside. So this is the photoaging, and if we would like to correct photoaging, then the main objective of whatever we are going to be doing is dealing with the hyperkeratosis, because hyperkeratosis is having a very bad insult and impact on the skin, as we are going to see in the next few slides. So this is the difference between the chronoaging and the photoaging, two different processes which needs different approach. Now, I have a question for everyone. Is it possible to have chronoaging without photoaging? And the answer is yes. Our skin, which is hidden from the light exposure, it is not going to have photoaging. It is going to be subjected only to chronoaging. It is going to lose the collagen and the elastin. It is going to be thinner and more atrophic, more delicate with age. The areas which are going to be exposed to the sun and to the light and to the injuries are going to have photoaging. And by the time we are having photoaging, the process of chronoaging is going to be ongoing. So there is no possibility of having photoaging without chronoaging. By the time we got photoaging, then we have also chronoaging. This means that if you have someone who's having photoaging with hyperkeratosis, thick, coarse skin, besides treating the hyperkeratosis, it is very important also to do something to stimulate the collagen and rebuild the collagen in that skin. What do you think about this patient? Is this patient having chronoaging or photoaging or both? I think we all agree that this patient is having both. We can see the hyperkeratosis in the areas which are exposed to the light, deep, coarse wrinkles. However, on the neck, she is having chronoaging, thin, delicate skin with loss of collagen, skin laxity. So we have chronoaging at the level of the neck, and we have both photoaging and chronoaging on the face. So this is how we should evaluate the patient in order to be able to build the right treatment plan for that patient. It is vital to remember that our skin is composed of three distinct layers. We have the epidermis, we have the dermis, and then the subcutaneous fat and tissue. And each of those layers is undergoing aging process, undergoing changes of the structure, deterioration of function, and then it is going to contribute to the appearance of the manifestations of skin aging. This is vital and important because when we are designing a rejuvenation plan, it is very important to remember that we need to target each of those layers in order to restore the structure and the function of each of those layers, hence achieving rejuvenation of the skin. If we didn't do that, then we didn't do a good job. We will not be able to achieve the optimum outcome of whatever we are doing. If we start with the epidermis, it's important to remember that the normal healthy structure of the epidermis should be like this, composed of 35% corneocytes and 65% living cells. So this is the normal healthy composition of the epidermis with intact barrier function. With aging, with photoaging namely, we are going to have hyperkeratosis. The skin is feeling that there's injury coming, affecting the skin. So it tries to protect itself by increasing the population of the corneocytes. So the corneocytes population is going to increase from 35% up to 60%. And when that happens, it happens on the expense of the living cells, which are going to be diminished down from 65% down to 40%. When we have this structure of the epidermis, this patient is not going to come to tell us, I have hyperkeratosis. They don't know what hyperkeratosis means. It is our role as practitioners to diagnose hyperkeratosis and try to do something in order to correct it. Those patients are coming to tell you, my skin is looking dull. My skin is not viable. I don't feel that my skin is youthful anymore. This is the first comment. The second comment is that those patients are going to tell you, I'm using the best skincare products and the best brands, but nothing is working. Yes, nothing will work because when the skin is having hyperkeratosis, whatever active ingredients we apply on the skin is going to be absorbed by this thick layer of corneocytes, and whatever penetrates is going to find less number of living cells to work on. So this means that the efficacy of any active ingredients and any skincare products is going to be minimal, because it's going to be consumed by a thick layer of dead cells and very thin layer of living cells. So it is not going to be effective. So the second complaint is that they are not feeling that the skincare products are as effective as they used to be. The third comment is that they complain of skin dryness. Their skin is dry. And why is that? Because we have defective epidermal barrier function. When we have hyperkeratosis, the skin is not closed enough. The skin is like that. And instead of very good overlap between the corneocytes, they are overcrowded, so they are pushing each other very much, and this will create gaps and cracks, as we can see in this photo. And those cracks are going to allow transepidermal water loss. The skin is vaporizing the water. So with this, we are not going to be able to hold in the moisture. And when the skin is losing the water, it is losing the hydration. When the skin is losing the hydration, it loses the elasticity. And when the skin is losing the elasticity, we are going to have rough skin. The skin is not going to be smooth anymore. We are going to have large pores, and we are going to have fine lines and wrinkles just by increasing the transepidermal water loss and dryness of the skin. Let me show you a proof that impairment of the skin hydration will lead to impairment of the skin elasticity. I think this is a very popular photo. I have always showed this photo in order to highlight the relationship between the skin hydration and the skin elasticity. This is a baby, a child who's having gastroenteritis. And with gastroenteritis, this poor baby is losing fluids, vomiting, and diarrhea. So it's very important to teach the parents this test. So every now and then, they have to pinch the abdominal skin. If the abdominal skin does not retract, as we can see in this photo, this is a clear sign of dehydration. And this baby needs to rush to the hospital because this baby requires intravenous fluids. This is showing the impact of the skin dehydration on the skin elasticity. On a smaller scale, sometimes we perform that test. So we pinch the skin of the dorsum of the hand, and if it takes time to retract, then this is a sign of dehydration. So you can all perform that test. Most of you are going to see good retraction of the skin, which is a sign that you don't have major dehydration of the skin. However, it is very important to know that if the insult and the impact is on the cell level, as we can see under the microscope here, then there will be a degree of loss of skin elasticity, and this will be associated with impairment of the skin elasticity and impairment of the smoothness of the skin, which is going to lead to large pores, roughness, as well as fine lines and wrinkles. So it is really very important to remember that when we have this structure of the epidermis, which is going to be the case in most of us when we are not doing anything to take care of the epidermis, then we are going to have this structure. We need to treat this condition by any keratolytic procedure. This can be several things. It can be chemical peels. It can be the use of retinol-containing products for 6 months. It can be by laser peel. It can be by mechanical peeling with procedures like silk peel, hydrofacial, mesojet, oxygeneo, and others. So this is actually what we need to do in order to restore the normal structure of the epidermis within short period. When that happens, we are going to improve the structure of the epidermis. We are going to enhance the proliferation of the living cells, so the function, the structure is going to improve, and this will make the skin much more viable. The absorption of anything we apply on the skin is going to be much better in this scenario, and the barrier function of the skin is going to be restored. So the skin is holding on in the moisture, the skin is going to become smoother, and it is going to be much better looking. In many cases, people are coming to complain of problems beyond the surface of the skin. It is our task to examine the skin. In most of the cases, we are going to see an impairment in the epidermal barrier function, which we need to work on in order to improve the epidermis. And this is going to be reflected very positively on any other procedure we are doing on the deeper layers of the skin. Because if I did something to stimulate the collagen or tighten the skin or improve the melasma, while I did not improve the epidermis, the outcome is never going to be optimal. So we have to remember that when we work on the dermis or the subcutaneous fat and tissue, it is very important to remember that the epidermis is insulted and affected, and we need to do something at the level of the dermis, the epidermis, as well as the other layers. Regarding the dermis, it's, as I mentioned before, we start to lose 1 to 2% of our body collagen every year, and the loss of collagen is going to be doubled in the areas exposed to the light. So it is very important to do something in order to compensate for the lost collagen by doing one of the procedures associated with collagen induction therapy. What are those procedures? We can use the dermal needling, we can use the fractional lasers, we can do the microneedling radiofrequency, and we can do the non-ablative lasers, Nd:YAG lasers, in order to stimulate the collagen. What about the deeper soft tissue? We get fat atrophy with aging, we get weakening of connective tissue support structures, we get some fat accumulation in certain areas and fat loss in other areas, and this is going to be reflected by visible effects like subcutaneous tissue shift, loss of volume, and localized fat pockets. So those are insults and problems which affect the subcutaneous tissue and fat. So it's very important at a certain point to address the subcutaneous fat and tissue. So at the end, rejuvenation is a concept. It is not a single procedure. We need to achieve 5 cosmetic targets to achieve rejuvenation. We need to improve the skin condition and removal of the skin damage. We need to stimulate the cell division, which is becoming slower with aging. We need to guarantee the skin nutrition. We need to improve the cell functions. And finally, we need to achieve protection and anti-aging. Otherwise, the problem is going to come back very soon. So it is really very important to design a full plan. The good news is, if we implement this concept, this rejuvenation concept, then we are achieving anti-aging, and we are able not only to stop the progress of skin aging, however, we are able to revert the signs of skin aging, as we are going to see soon. The bad news is, as practitioners, we are unable to achieve all the 5 cosmetic targets. We can do a procedure to improve the skin condition and removal of the skin damage. Most probably, this is going to result in stimulation of the cell division, and then our role stops. We cannot do anything more. What about the 3 remaining cosmetic targets? This is the homework of the patient. The patient has to know that they have a task, and if they didn't do their homework, we are not going to get an optimum result. Our procedure is not going to achieve the best result. Our procedure is not going to have a long-term impact. If they didn't use the appropriate skincare product to guarantee the skin nutrition, if they didn't improve their nutrition and water intake, if they didn't use the appropriate skincare in order to improve the cell functions and the sunscreen and the anti-aging skincare products, then the improvement we are going to achieve with the procedures we conduct is going to be temporary, and it's not going to be fulfilling its optimum results. This is something to be discussed and communicated with our clients, and we have to know that we are in the same boat. If they didn't do their part, they shouldn't ask about our part. What are the options we have in hand for achieving rejuvenation? We have topical preparations which can improve the structure of the epidermis, and this includes chemical peeling as well. We have dermabrasion and microdermabrasion, which is mechanically improving the epidermis. We have tissue augmentation, which can improve the quality of the skin and the appearance of the skin very quickly. We have the botulinum toxins, which are going to deal with the dynamic wrinkles by relaxing the muscles, which leads to exaggerated expression lines. We have the mesotherapy and the PRP, which is targeting the dermis to stimulate the collagen, improve the water content and the viability of the dermis. We have the skin needling with or without fractional radiofrequency, and this is a procedure which is used mainly to stimulate the collagen, so it targets the dermis. We have the tissue tightening with RF, infrared, and ultrasound, and those technologies are targeting the skin laxity and try to tighten the skin. We have the laser rejuvenation, which is the non-ablative rejuvenation, which is targeting the dermis to stimulate the collagen. And finally, we have surgical procedures, which is not considered rejuvenation. It is just improving how the skin is looking. Now, it is really crucial to understand the extent of the problem in the skin of the patient, where it is located. Is it in the epidermis, the dermis, or the subcutaneous fat and tissue? And accordingly, we are going to choose from those different procedures the appropriate one to target the right level. In many cases, the insult and the damage is present in more than one level, and that's why we need to do combination therapy and to mix and combine those treatment plans in order to get the best improvement in each of the skin layers with the best technology for that particular layer. So here comes the 4D rejuvenation. It's a concept where we would like to target the epidermis, the dermis, the skin laxity, as well as the intraoral tightening. We started a few years ago, maybe 10, 15 years ago, with the concept of 3D rejuvenation, where we were targeting the epidermis, the dermis, and the subcutaneous fat and tissue in the same session with different technologies in order to improve the epidermal barrier function, stimulate the collagen, and tighten the skin. Now, with the Fotona SP Dynamis, we have an additional layer to add where we are able to deposit some laser pulses below the surface of the skin in order to heat the skin from below the surface, and then do the piano in order to tighten the skin from outside the skin surface, and then use the non-ablative rejuvenation with the frag 3 of the Nd:YAG of Fotona to stimulate the collagen, and after that, do the superficial peeling with the Erbium YAG in order to improve the epidermis. So this is the concept of the 4D. The only place where we are able to treat and deposit heat below the surface of the skin is from inside the oral cavity, where we are able to use the long pulse Erbium YAG, the smooth mode of Fotona, in order to deposit heat, not affecting the surface. The heat is deposited under the surface in order to achieve tightening of the undersurface of the skin, which should be followed by the long pulse Nd:YAG with the piano mode of the Fotona SP Dynamis Nd:YAG, and then do the frag 3 and end up by superficial peeling of the epidermis, which can be replaced by doing one of the microdermabrasion procedures before the treatment if we don't want any kind of downtime. So when we do that, we are targeting the epidermis. We'd like to transform this epidermis into that one, which is going to have much less hyperkeratosis and much more living cells. So the skin is going to be much more viable. It will absorb the skincare products in a much better way, and it's going to hold in the moisture, so the skin is becoming smoother, and we are able to improve the fine lines, wrinkles, large pores, and restore the smoothness of the skin. Then we need to target the upper dermis in order to stimulate the collagen. This can be done with the fractional lasers, as I mentioned. However, many people today are very dynamic and they're very sensitive for the down payment. So using the Nd:YAG, which is non-ablative, which is associated with no downtime, might be an ideal scenario, especially when we are dealing with darker skin people or people who are tanned, as this procedure is associated with zero downtime erythema for 10 minutes, and that's it. And then if there is skin laxity, it is very important to do some tightening of the skin. It is not correct to pay attention in such patient to improve the epidermis and stimulate the collagen and forget about the skin laxity. When we do that, the skin is going to be much younger, and we can see very significant skin tightening with this simple procedure, which is the 4D. So some quick facts about non-surgical facial rejuvenation. We need to achieve a minimally invasive procedure, which is associated with little to no downtime. We can smooth the wrinkles, restore the volume, tighten the sagging skin, improve tone and texture, and treat sun damage at the same time. This is what we would like to achieve in the non-surgical facial rejuvenation. Now, when we talk about Fotona 4D, this is a non-invasive laser facelifting. We are able to achieve laser tightening and volumization without injectables. In this case, it is non-invasive. There is no downtime. We are able to achieve full thickness contraction of collagen, and by that, we are able to improve the wrinkles and the skin texture at the same time. So as we can see, for different problems, we are having different options. However, when we look at the 4D, we can see that the 4D can improve and minimize the sun damage and age spots. It can reduce the expression lines by improving the skin tone. It can reduce the mild jowling. It can tighten the neck, definitely. It can rejuvenate the sagging brow or eyelids by tightening. For the smooth facial wrinkle and folds around the eye, we are able to use the smooth eye around the eye. And also the upper chest, we can improve it with the 4D. So for the lip, we can use the lip lace. So we can see that there are so many things which we can use the 4D for. So this is a technique where we are having two laser wavelengths, the urban YAG and the ND-YAG. And we have 4 treatment modes in order to target the different layers of the skin. We are able to achieve comprehensive approach to the rejuvenation from 4 different levels of the skin. And we are able to target the deeper medial and superficial connective structures of the skin, as well as targeting the imperfections. What about the intraoral tightening? This is a non-ablative urban YAG intraoral treatment for controlled and gentle bulk heating to stimulate collagen contraction. Overall improvement of tightness and elasticity in the treated tissue is achieved. Plumbing effect to the nasolabial fold from inside, much like a filler. Here it's very important to remember that when we are using the urban YAG, if we are using short pulse and high fluence, we achieve ablation. Whereas if we are using sub-ablative fluence, so low fluence, in long pulse train, we are able to get heating to the tissue, as we can see here in this graph. And this is a video which is showing that if we are using short pulse duration, then we are going to get ablation and the skin is not going to contract. This is a piece of skin, and we have 2 black markers. When we are doing ablation, we can see that the black markers are staying as they are without any tightening of the skin. However, if we change its setting and we use a longer pulse duration, which is associated with skin tightening, we are going to see that the 2 black markers are becoming closer to each other because of the skin tightening, which is achieved with this long pulse urban YAG, which is depositing subdeep below the surface of the skin. So I hope you can see that tightness which affects the skin with this long pulse urban YAG. Of course, the surface impact is not going to be the same when you are using the smooth pulse urban YAG because it's much longer pulse duration. So those are the lines which we would like to cover from inside the mouth, where we are using the long pulse urban YAG in order to try to cover everywhere from the oral cavity. And those are the parameters we are using. We are using the urban YAG smooth pulse. I'm using the R11 and piece is 3.5, 3.75, 1.7.
Dr. Badawi, I think there is a problem with your voice. Did you change something? Because it's a bit garbled, the voice.
Oh, really? No, maybe there was a video. Is it okay now?
No, it was very good until maybe just a minute ago.
So now you cannot hear me well?
The voice is very, very garbled. It's very, very muffled, so I can't really hear.
Okay.
Yeah.
Let me try to get headphone or something. Okay.
Do you want to maybe mute and unmute or something like that? Or you didn't change your microphone, right?
I didn't change anything. Let me unmute. Is it better now?
No.
Okay.
Do you want to?
No, let me get the headphone.
Okay. Okay.
So, is this better now?
Yeah, definitely much better. Definitely much better.
Okay. Okay. So I apologize for this technical issue. I don't know what happened, but hopefully the voice is restored now.
Yeah, it's good now. It's
Yes.
good. Thank you.
Okay.
Thank you.
Perfect. Perfect. Okay. So let us go back a step and show you that we are supposed to be covering those lines from inside the oral cavity in order to achieve good tightening. The objective is to improve the nasolabial lines and the marionette line. And we are using the erbium smooth pulse with R11, 3.5 to 3.75 joule per centimeter square with 1.7 hertz. And we are doing about 10 passes. So usually my protocol is to do 5 passes and then one stacking pass and then another 5. So total of 11 passes. And this is the video where I'm doing the pulses, as we can see. So those are the pulses for the intraoral cavity, and we can hear the sound of the laser. And this procedure does not require any anesthesia. It does not require any cooling. It is very tolerable without any need for any kind of analgesia or anesthesia.
Okay, Badawi, do you get any irritation or inflammation of the oral mucosa that the patient should, I mean, any downtime when you do the intraorally?
Not at all. If we did it correctly with homogeneous application of the lasers, of the laser passes, then it's okay. If someone who is just starting and did overlap a little bit more, we can have a small ulcer or something, but it shouldn't happen with the right experience and with the right technique.
Thank you.
You are welcome. So this is the screen of my device, and this is what I'm using. As I said, the R11 handpiece, 7mm spot, 3.75 joules, and I go up to 2 hertz now after some experience. I started with 1.7, and this is what I would encourage everyone to start with. And then after some time, you will be able to feel comfortable to increase the repetition rate and go a little bit faster without any problem. So after doing the intraoral, I changed the protocol. The original protocol of Fotona is doing the smooth lifting, the intraoral, and then the frag 3, and then the NDIAC piano, and then the superficial peel. For me, I feel it makes more sense to go from the deepest point to the deeper, to the more superficial, and so on. And that's why I do the intraoral, which is the deepest point, and then I do the piano, which is for the subcutaneous tissue and fat, and then I do the refractory for the derms, and then I do the Erbe-Miak peel, or I do, instead of the Erbe-Miak peel, the microdermabrasion before I start the laser. So the Nd:YAG tightening, we are using here super extended second pulse mode. And I have to stress on the fact that this is the only Nd:YAG laser in the market, in the international market, which is having pulse duration in the seconds. Any other Nd:YAG system in the world is having milliseconds. So this is the only system which is having pulse duration in the seconds. So we are doing brushing technique for completing the full thickness bulk heating for the overall synergetic tightening effect. When we achieve deep tissue heating, then we are able to tighten the skin in a very effective way. So this is the procedure, and this is almost at the end of treating half of the face and the neck. For me, the face and neck is one part, one region. I cannot treat the face without the neck, and I cannot treat the neck without the face. And almost at the end, we can see the difference between the treated side and the untreated side. Can you imagine that all the neck was like this, and then by the end of the treatment, we are seeing how much the skin becomes tighter, partially due to the edema and partially due to the collagen shrinkage and the tightening of the skin. And this is something which we are going to see on immediate basis, which is very impressive for the patient to see this kind of improvement. Let me show you the technique. It is brushing technique. So we are just painting the laser pulses on the surface of the skin. As we can see, it is associated with no pain. We don't need cooling. We don't need topical anesthesia. And we monitor the temperature of the skin because the objective is to achieve a temperature of 42 degrees, maintain it for 3 minutes, and then we are going to achieve an excellent result and improvement. Yes, there was a comment about the initial protocol of the Fotona regarding the intraoral, the PS03, and yes, that's true. However, also this is a modification which I suggested for Fotona, and they listened, because when we want to tighten, then we need to cover 100% of the surface. I don't want partial effect on the surface. If I use PS03, this is a patterned handpiece, so I'm not able to cover 100% of the surface. However, when we are using R11, then it is going to be much more effective in covering the whole surface of the skin. Any more questions? Intraoral treatment, what are the precautions before treatment, after treatment, and the procedure related to prevention dental procedures? Actually, for the intraoral treatment, there is no preparation required, and at the same time, there is no post-procedure care required. It's a very mild procedure. Nothing is required before or after the treatment. There is no interaction between any dental prosthesis or any denture in the skin. You have to know that dentists are using Erbe-Miak, but with 100 times the power we are using. So it has no risk on the teeth or the gums or anything. So we are going to carry on, and at the end, I'm going to look at the questions, if there are any questions. Monitoring the temperature is very important, because raising the temperature of the skin to 43, 42 degrees and maintaining that for 3 minutes is vital. And this is the neck, the area I treated, and this is the neck in the area I did not treat. See the difference between the texture of the skin, and this is immediate improvement of the skin, and it's going to be well maintained, as we are going to see later on. This is another video with the procedure where we are seeing the procedure. In this Fotona accessory, it is a view matrix view, which is having a temperature sensor, and we adjust the temperature. What is the minimum? What is the maximum? And then when the temperature is at the set level, it is giving yellow color. If it is below the set level, it is green. And when it goes above the set level, it goes to red. And we have to be doing painting, as we can see, while the skin is stretched in order to have better optical penetration. As we can see, the patient is relaxed, there is no pain, I'm not using cooling, and everyone is happy. So this is the kind of improvement we can get. Very clear, very nice improvement in the jawline. Laxity in the skin is improved. This patient didn't want to go for surgery. Of course, it is not the same result of surgery, but I believe that we can all agree that this is very significant and very satisfactory result for a patient who does not want to go into surgery. Again, another patient where we can see very nice tightening of the skin, very good improvement in the texture of the skin, and this is what we can achieve with this nice technique. And this is another patient where we did the smooth pulse with R11 handpiece up to 10 passes, and then we did the piano from outside plus the frag 3, and then this is 3 sessions, 1 month apart, and we can see the improvement in the nasolabial line and in the marionette line, significant improvement actually. And this is another patient, 3 sessions, 1 month apart, and we can see the improvement in the nasolabial line and marionette line, and the patient usually are very, very satisfied. And this was a patient who had mild laxity, and 1 session was enough to achieve such nice improvement and result. And this is another patient which is having only 1 session to get this kind of improvement with a procedure which is associated with no downtime at all, except if we are using the superficial peeling, we can get some superficial peeling for a few days. Now, in order to target the dermis, we need to target both the hemoglobin and the water in order to achieve photobiostimulation and stimulation of collagen. And the only wavelength which can target both the hemoglobin and the water is the 1064. And that's why nothing else was as successful as the 1064 when it comes to the non-ablative rejuvenation. Before the Nd:YAG, they tried many other wavelengths. Those wavelengths were either targeting the water or targeting the hemoglobin, but nothing was able to target both the hemoglobin and the water like the Nd:YAG, and that's why the results we are able to achieve with the Nd:YAG for non-ablative rejuvenation is unmatched. So the parameters that I'm using is the 1064. We can use the 6 millimeter with 15 joule or the 9 millimeter with 10 joule per centimeter square. After some experience, I was able to increase the parameters more. If I'm using the 6 millimeter, I use 0.3 millisecond. If I'm using the 9 millimeter, I have to use 0.6 milliseconds. We use 5 to 10 hertz. We don't use cooling. We need to heat the skin up to 43 degrees for 3 minutes. We don't apply anesthesia because pain is a protective mechanism, and I need the patient to feel pain and express the pain if the heat goes too much up. We don't do contact, so we are about 2 centimeters above the surface of the skin to easily move the handpiece in painting fashion. And we don't apply topical steroids. The skin is going to be erythematous after the procedure, but we don't apply topical steroids because topical steroids will suppress the inflammation, whereas we need the inflammatory process in order to attract fibroblasts and synthesize new collagen. Monitoring the temperature is very important. And this is a study I published with some colleagues in laser and surgery and medicine in 2011 about using this non-ablative scar treatment, dark skin, with the sub-millisecond Nd:YAG. So any Nd:YAG which does not go below 1 millisecond is not going to do a good job when it comes to rejuvenation. In this paper, we combined both the Nd:YAG with microdermabrasion. The microdermabrasion was used to improve the epidermis, and the Nd:YAG was used in order to stimulate the collagen. And they did put our photos on the cover page. It was very impressive to be able to achieve excellent and significant improvement of dark skin without any complications or without any side effects. So we started the process with the microdermabrasion. At that time, it was the classic diamond peel, which is a mechanical abrasion to remove the excess corneocytes, which is going to stimulate the proliferation and rejuvenation of the living cells. At the same time, this procedure is improving the lymphatic drainage because of the vacuum associated with that procedure. This was done 4 times on weekly intervals. When the epidermis is really impaired, then we can do up to 6 sessions. And this is associated with no downtime or any complications. After the first session, we can do the laser immediately. And those are the parameters I mentioned before. So we clean the skin well, and then we start to do the Nd:YAG with the same parameters and procedure. We are painting 5 hertz, so 5 pulses per second. We have to be in painting mode in order not to overheat the skin. Monitoring the temperature is important. 42, 43 degrees for 3 minutes, and we are done. And this is the outcome where this is one of the patients we treated with severe degree of scarring after chickenpox. And we can see the degree and the extent of improving the skin, stimulation of collagen, not only at the level of scars, but the whole texture of the skin improved significantly. And this is something which is really reproducible. We can achieve it in many cases. We treated thousands of patients, and I cannot remember a patient who did not get improvement. This is the patient who was on the cover page, where she's having multiple problems: hyperpigmentation, acne scars, large pores, active acne. And within 3 months, 3 sessions of laser and 6 sessions of microdermabrasion were able to transform the skin into a much healthier skin. Another patient, we can see the improvement in the texture of the skin and how much the skin became much smoother. And this is a patient with acne scars. We can achieve excellent outcome, but this was associated with subcision as well. And we can see the excellent improvement when we combine the microdermabrasion with the Nd:YAG laser. With the same concept, we are able to achieve nice lip rejuvenation, where we are able to stimulate the collagen, regain the volume, the lost volume of the lip in a very natural and very normal way. This is a major difference between using fillers and using the laser. The laser is restoring the volume of the lip back to how it was a few years ago. With the fillers, sometimes we are overcorrecting, and this is something which many people are not happy with. We can see the plumbing of the lips and restoration of the volume in a very natural way, and this is something which is really reproducible. We do 3 sessions, 1 month apart, and then after that we wait for 6 months for the collagen maturation, and we need to maintain by having 2 sessions per year. This is the procedure, a short video which is showing the procedure. So the pulses are not going to be applied on the lips alone, because it's going to overheat if we apply it only on the lips. So we have to apply it on the perioral area, focusing on the lips. This is going to improve the whole region in a very nice way, especially the lips, which are going to be restored back to how it was a few years ago. Very simple procedure, requires no anesthesia, and the patients are usually happy. Many cases, they come whenever they are having wedding, they do the procedure, go put makeup and go to the wedding with very nice looking lips. This is the patient we treated, and we can see how much her lips are becoming much more full and having very nice contour at the end of the procedure. So this is the patient after the 4D with the superficial peeling of the skin, smooth eye, lip lace, the intraoral, the piano, and the frag 3, and the superficial peeling. And this is how the patient was looking immediately before the procedure. I think you can see the difference. When we are able to conduct a procedure within 45 minutes and come up with a patient who is looking literally 10 years younger, this is a major achievement. This is really a major achievement. Look how sad looking she was, and how she changed and transformed within 45 minutes after the laser session. So the anti-aging program, after we do those basic sessions, we advise the patients to come 3-4 visits per year in order to maintain and improve the quality of the skin. Usually those procedures are associated with no downtime. it's going to be associated with reasonable cost, because the patient should pay on monthly basis instead of per procedure. So it's going to be distributed over the year with not a major payment, and it is going to be associated with affordable monthly payment. No high expectations, because when we are having this procedure, our main objective is to maintain the skin in good shape. So the patient is not over expecting. If the patient is having a scar, then after a procedure, they are going to be looking in the mirror every 5 minutes to see if the scar is still there or no. But when we are doing the anti-aging and the prevention of the skin aging, then the expectations is to keep the skin in good shape. And in 10 years, patients will look the same or even better. This is what we can promise them. And this is actually what we are able to achieve. This lady, we started with her in 2012, and we can see her skin and how it was looking. And then in 2015, which means 3 years older, her skin is looking really much younger. So I would think that we all agree that in this photo, the patient is looking about 10 years younger than here, although she has grown 3 years. So she is supposed to be looking 3 years older than here, but this is not the case. The patient became older, but she's looking younger. And this is her neck in 2012, and this is her neck in 2015. Here she was 68 years, and here she is 71 years. And her neck here is looking much younger and much better. And again, this is her skin. We can see the elastosis and the wrinkles and how her skin is becoming much better. And this is again her left cheek. And we can see the improvement in the texture and the structure of the skin. This is another patient in 2012. 3 years later, she is looking much healthier, much better. Her skin is looking really younger, although she is 3 years older. And this is another patient, and we can see over 5 years, her skin transformed and looking much younger than 5 years ago. And this means that we are not only stopping the process of aging, but we are reverting the signs of aging of the skin. And this is what we are able to achieve.
Dr. Badawi, the video doesn't have any sound. Should be like that, or should I have a sound?
There is a sound, but I don't know. There is a sound. However, I mean, the text is enough. It's okay.
Okay.
Yeah. It is just music. So this is the intraoral treatment. The intraoral treatment, which is targeting all those areas. We can improve the skin texture with the FRAC3, which is with the original protocol of Fotona. It is the second step. I do it as the third step. The third step is skin tightening, which I do it as the second step. And then we do the fourth step, which is the light laser peel, in order to improve the superficial textural changes in the skin. And this is going to improve restoring the youthful skin, tightening and volumization, improvement of the imperfections of the skin. Some before and after photos. The nasolabial lines improve, the texture of the skin improves, the wrinkles improve. This is the patient I showed, and we can see really that we are able to turn back the time. So we are able with this technique to improve or reduce the wrinkles. We are able to improve the texture and the appearance of the imperfections, reduction of the nasolabial folds, and improve the tightening and the sagging. Now, does everyone need 4D? No. If we have skin laxity, but it is not affecting the nasolabial lines, then we don't need to do the 4D. We can do without the intraoral tightening. If we don't have skin laxity, then it's enough to improve the epidermis and do stimulation of the collagen. So it is something which we are able to tailor according to the need and according to the situation. With that procedure, I think we were able to find the fountain of youth, and we can improve the skin and revert the changes happening with aging back to how it was few years ago. One of the important things which I would like to highlight, this is the patient which I showed in the beginning. And we did for her the 4D procedure. After 3 sessions and waiting for 3 months, she came back saying that I did not improve. And this was her photo. So I told her, but I feel you improved. She said, no, no one is commenting that I have a better face. So I told her, let us see your before photo. And this was her before photo. But because the changes are happening gradually and slowly, sometimes it's not easy to note the changes. So documentation and taking photographs is crucial. Otherwise, we are not able to defend our case because we didn't have these photos and the changes are happening gradually. Actually, when the patient saw her photos of before, she couldn't believe that she got that much improvement, and she was not observing it. And then she was very satisfied, and she sent 5 of her family members and friends. So here, this is something which I would like to emphasize, that documenting and taking photographs is important when we are doing a procedure which is non-invasive, and sometimes the procedure and the improvement is going to happen on a very gradual basis. Thank you very much for your attention. And now, if you have any questions or comments, feel free to text them, and I'll be very happy to go through the questions and answer any questions which were not answered during the presentation.
Yeah, sounds perfect.
Okay.
I see a few questions, Dr. Badawi, but I think
Yeah.
you answered most of them.
I just would like to highlight that this is going to be recorded, and I think for the members of the Canadian Board of Aesthetic Medicine, the premium members are going to have access to the recording. So hopefully, if you are not a member of the Canadian Board of Aesthetic Medicine, I do strongly encourage you to become a member so that you are able to have an access to great resources.